Now, let's talk about thyroid function tests. Ooh, okay, this is the fun stuff, okay? This is stuff I definitely am going to ask you questions about, all right? Hint, 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 hint. I do this with my AP2 students, so you guys are right up there too. So what it is thyroid function tests. We have 3 tests, TRH, TSH, and T3, T4. Some places don't really consider TRH as a thyroid function, but I think it's to throw it in there, I think it's important to see. So you see the whole thing. And it's really utilizing the whole negative feedback mechanism to figure out how you can diagnose, how you can pinpoint the diagnosis. So I'll give you a few examples. We'll work with a few, and then you can do some at home. But try not to memorize. Just ask yourself, why do we get these results? Okay? So, we'll do our hypothalamic, pituitary, target axis. Right? Hypothalamic, pituitary, target axis. Now, normally, this is what happens, right? Hypothalamus is going to release a certain hormone in this whole thyroid thing. It's going to release what? What hormone? Which one? TRH, right? Thyroid releasing hormone. Okay? That's going to tell the anterior pituitary to release another hormone. That's the TSH. Okay? And the TSH is going to tell the thyroid to release T3 and T4, right? When TRH tells this, so when TRH increases, it's going to increase TSH, which means it's going to increase T3 and T4. T3 and T4 are going to increase. Right, so TRH is going to increase, TSH will increase. I won't throw these little things here. And that's going to make T3 and T4. That's what goes up, right? But this is going to increase and keep on increasing to high levels. Not good. So what's going to happen here is that you will have negative feedback. T3 and T4 says, whoa, we got too much down here. We got to tell the anterior pituitary and the hypothalamus, please stop giving us stimulation to make T3 and T4 coming out. That's negative feedback, right? That's right from AMP2, okay? Now, let's talk about diseases. Right? We clear with this? Anybody have any questions about this before we go further? Okay, so let's talk about Graves' disease. Okay? In Graves' disease, remember what's happening. We have this autoantibody that can fit right into here, and it looks like TSH, but it's not. This goes in here, turns it on. This is going to make T3 and T4 go up or down? Up. So it's going to increase T3 and T4. This is then going to tell the anterior pituitary and the posterior pituitary to increase or decrease TRH and TSH. To decrease it, right? So now you're going to have a decrease of TRH and TSH, right? It's going to tell the thyroid to stop making T3 and T4. Is it going to stop? No, because it's not TSH that's in here, it's this other imposter that's on here. And it's going to turn this on, and you will have a ton of T3 and T4 going, increasing. It's always going to have this negative feedback. The message will always be there, but this is not telling it to do anything. It's this. So look at this is your thyroid function test in a person who's got Graves' disease. A decrease of TRH, a decrease of TSH, an increase of T3 and T4. If I see a set of thyroid function tests here that show this, I know the problem lies at this level. What? I don't know. Is it a tumor there? I don't know. I can't tell. You see, the thing is, if I made this, look at what's going to happen. In Graves' disease, do you understand those results? Yes? If I had a tumor here, and it's going to spit out a lot of T3 and T4, right? You're all in agreement with that. As long as it's not a destructive cancer, it's actually one that's going to secrete this. So this will go up. Is that correct? If this goes up, what happens to TRH? Goes down. What about TSH? Goes down. What happens here? Now here's the problem with cancer. Two rules about cancer. One, generally speaking, a growing gland that's going to produce hormones, generally speaking, rule of thumb is it's going to produce a lot of hormones. There's a few destructive ones, as we talked about before, destructive tumors. But generally, if there's cancer over here, it usually is going to spit out a lot of T3 and T4. So that's the first rule. The other rule is cancer doesn't listen to anyone. They're not regulated by anyone. They're not going to listen. You tell it to stop, it won't stop. You tell it to go, it'll do whatever it wants. It'll go, it might not. It might just show itself and say, I'm not listening to you. In most cases, if it tells it to stop, they'll keep on going. So in a person who's got cancer of the thyroid, this goes up. It's going to tell the hypothalamus for the TRH to go down, tell the anterior pituitary to make this go down. What happens to T3, T4 if TSH over here is going down? Go up or down? It's cancer. It keeps on going up. So look at this. It's the same situation of Graves' disease or if you had a cancer of the thyroid. The same thyroid test. So this is why we do the thyroid function test first. And if we get this kind of setup, now and this is the mental map you put in your head. Well, if this is the setup here, then I know the problem lies here. Is it a thyroid cancer or is it Graves' disease? So now you do another test. I won't ask you about this, but you do another test. You could do an ultrasound of the thyroid to see if it's a cancer, or you can do a blood level test to see if you can pick up these autoantibodies. But you don't do your autoantibodies first without doing that first. You don't do an ultrasound of the thyroid without doing that first. It's step by step. Now what the insurance companies want you to do is the cheaper test first. So you do this. Blood tests are pretty cheap, most of them. You do this first, you get this results. Then the next test you want to do is the ultrasound, because that's about $100. If that comes back normal, then you'll do the Graves' disease test. That's about $500–600. You see how you're going step by step. But you're not memorizing, you're understanding. As Dr. Rose said over here, is that, geez, see the big picture here. It's not about memory. There is, you got to memorize the names of the diseases. I understand that. But the concepts, it makes sense, right? I won't ask you about how to decipher between Graves versus cancer. That's over the scope. But you can handle that stuff, but I won't ask you that. You should be able to pick up thyroid function test stuff. It's all about pathophysiology, right? All right, now let's do someone who's got the removal of the thyroid. So now what I'm going to do is we remove this because of cancer. Okay? So what happens to T3, T4? Right? Does that make sense? That's going to go down. Now this is too low, so negative feedback goes on. What's going to happen to TRH? It's going to go up. That's going to tell the anterior pituitary to do what to TSH? Increase. This is going to tell the thyroid to do what? We can't. There's no thyroid there. So look, in this case, this is different. Now when a person doesn't have a thyroid there, they're going to have thyroid function tests that will look like this. TRH, TSH, both TRH and TSH will increase, but T3 and T. See, when you look at hypothyroidism, the average student will say, well, everything goes down. It's like hypo means down. No. If you understand this concept, This is what goes down because but negative feedback is going to say these will go up. It's about understanding concepts. Is that clear? So does that make sense? Right? All right, let's do one more. Let's do a pituitary. Let's do a pituitary adenoma that's secreting a lot of hormones. So here we have the thyroid. But now what's happening is that we have a tumor of the anterior pituitary gland. Okay? So far so good? You could probably do this on your own, but let's do it. So here you're going to have a pituitary tumor, right? So is there going to be a lot of TSH or a little bit? A lot, right? So it's going to increase. If this increases, what happens to T3, T4? It increases, right? If this increases, what does it tell the hypothalamus to do? Decrease or increase the TRH? Decrease. Good. Okay. What's it going to tell the anterior pituitary to do? Decrease, but right. So even if there's less of this, this is still going to put out. So now you have a different situation. Here's where you have a decrease of TRH, an increase of TSH, and an increase of T3, T4. Does that make sense? Right? So if you have those results, it's got to be happening here, the level. You could do, I could go on, but let's say you have a stroke to the anterior pituitary, which means it's going to be destroyed. Then what happens to TSH, T3, so do those other ones by yourself. See if you can figure out those things. This is really telling me, if you understand this, then I know you understand negative feedback. That's why I do this with my AMP2 students. It's not bad. Come on, it's better than Sudoku. Right? It's fun. And I tell you, if things are making sense, they become more fun. Okay? So questions about the this whole thing here? But hint, there's going to be a question or two or three about this kind of stuff. But I could do the same thing here with, let's say, your ovaries. Like I just talked about the thyroid here. But you could have GnRH telling the anterior pituitary, let's say remove the ovaries, right? So you have GnRH telling the anterior pituitary to release FSH, to tell the ovaries to release estrogen. But there's no estrogen, it's the same setup. If you understand the hypothalamic pituitary target axis, then play with all those other things. That's why I could give you other things in there. For the cortisol, I could give you all those other things. But it's the same concept. That's what Dr. Bro was saying, is that understand the concept, then you can apply it to other things.